In 2011, Solomon Islands declared NCD a national crisis. At least 12% of all adults in Solomon Islands have diabetes and 26% have hypertension. Each year, they are responsible for $90 million in healthcare, productivity, and other social costs. This is 6.3% of the country's GDP.
Uncontrolled diabetes and hypertension are the leading cause of mortality, morbidity, as well as disability here in Solomon Islands.
Over the last few years, I've seen the number of diabetic foot infections increasing for it to occupy up to 60% of the surgical beds in the hospital.
Globally, health worker training is done everywhere, but unfortunately, it is common for health workers to return to health services without changing their practices. A national baseline assessment in 2024 found that of all diabetes cases, 8% were managed correctly. For diabetic foot cases, 11% were managed according to national standards. For hypertension, 43% of required clinical tasks for blood pressure measurements were done correctly, and less than half of clients were told their blood pressure status. Innovative methods can build on previous efforts to strengthen primary care practices. This program, championed by Solomon Islands Ministry of Health and Medical Services with support from the World Health Organization, targets this crisis with a strategic approach, beginning with coaching.
Coaching have no involve PowerPoint presentation or handouts. So I'm asking question, me answer, and so I'm more involved inside. So time I go back, so me no need a book for it, but also I'm stay thinking long pana.
Coaching key practice skills was just the beginning. Even as knowledge and skills improved, several barriers at the clinic level made it difficult to apply the standards consistently. This is where quality improvement was introduced. To improve diabetes, diabetic foot, and hypertension screening and management, clinics made 6 key changes. Health facilities are now decluttered and reorganized, creating more functional space. Everyone over 40 years old is now screened. Tasks are split across stations, allowing staff to care for clients simultaneously. Foot screening is now routine for all diabetes clients for early detection and management of risk factors to prevent amputation. Updated NCD registry book to align with national standards. A tracking system to contact clients for their follow-up to enable a timely return.
Quality improvement, hembara help mo tenesis po save do ma waka properly. So tayo mo tabgaran bisala ownership for this program ne or tenesis or actively participate for sorting out own areas blocketa.
Clinical indicators improved significantly in the first year of the program. In early implementation clinics, the number of clients screened for diabetes and hypertension increased by over 7 times. Detection of new diabetes cases increased by 4 times. Diabetic foot screening was received by hundreds of clients who had never been screened before. Diabetes, diabetic foot problems, and hypertension are silent diseases that often do not have symptoms. Before, screening was not routinely done, and high-risk clients were often missed. Now, almost all clients receive the screening package for these conditions. By identifying problems early, health workers can help prevent serious complications such as strokes, heart attacks, and limb amputations.
This time, something improve. So me feel happy everything you do him, so some patient and satisfied too.
This initiative will support and strengthen the ongoing NCD program in the country.
If we can stop this epidemic of amputations that is plaguing this country, we have done something that deserves, it is a miracle what we have done. And you all are part of a miracle.
This model will be replicated to other clinics, and I'm sure this strategy will continue to save life and promote the definition of health as per the WHO definition.
The program is now expanding to other provinces with plans to reach the entire country, coaching more health workers and improving care nationwide.
I must sincerely acknowledge WHO to put my health workforce as a champion of preventing physical disability.
This progress was made possible through the generous support and contribution of our partners.